Hello, today we will talk about Code Green, disaster preparedness. First, we'll go back in history, so we'll talk about the disaster medical system. Disaster medical system has been in existence since the Cold War. It was originally designed to manage large number of military casualty from a battlefield. The modern era of healthcare preparedness began in 1996 in response to increasingly frequent terrorism events in the 1990s. In 1995, such as bombing, biological and chemical terror attacks, and frequent natural disaster. At the hospital level, significant change occurred in early 2001 with the release of the new, much stricter Joint Commission standard for the emergency preparedness. These new standards were just begun implemented when the 9/11 attacks followed immediately by the anthrax letters. So what is Code Green? Disaster preparedness. It's a code used to alert PSH staff to an emergency situation that exists inside or outside the hospital, and the activity process for the facility to move to a disaster response footing. So what is disaster? A disaster is any situation outside the hospital where there are likely to be so many casualties that a special arrangements are necessary to deal with them, with a threat to the health of the community when the normal health service are interrupted. For example, transportation or airport accident, mass community food poisoning, explosion, industrial accident in chemical manufacturing plants, natural disasters such as floods, sea or water disaster, and outbreak of epidemics. So what is the purpose and scope of this? The policy outlined the hospital response to a disaster situation, which required the institution to provide medical care for the victims. The outlined responsibility of individual and department in the event of an emergency disaster to coordinate care of disaster victim in safe, efficient, and organized manner to protect the caregiver to maintain the ability of PSH to respond to the need of current and future patients. So our Bahrain Specialist Hospital policy statement. Bahrain Special Hospital will be prepared to receive, treat, and care for casualty of any disaster which are within the scope of the hospital and its resources. The BSH will primarily act as a secondary care area when required by the MOH to provide first aid or medical treatment to the casualty inside the hospital, subject to approval of the manager director and the CEO. So each year we have a disaster drill to make sure that everyone familiar with the situation and the policy. So the emergency room provides the first line of medical management for victim Code Green. In the ER coordinator, the provision of its services by implementing its disaster policy. All BSH staff attends in service training on Code Green and participate in a disaster drill. Assigned staff shall receive an action card identifying their responsibility and their duty station during the disaster. This disaster drill will be held yearly. These are the action card pictures. Here will be the identification name and the responsibility assigned to the person. So the responsibility of each department. Each unit, division, and department in BSH is required to develop and maintain a telephone calling tree, initiate calling tree when necessary, respond to Code Green as prescribed in the policy, direct staff without specific responsibility to report to manpower pool. All employee attending disaster will wear uniform or their ID badges. No person may call back to query Code Green. Staff are to report immediately to the hospital. Once disaster has been declared, all BSH staff remain in duty until released by their immediate supervisor. No visitor will be allowed into any patient area during an external or internal disaster. So who managed all of this? We have the command control team, the CCT team, which is the managing director, the CEO, the director of the hospital administration and finance, medical director, director of nursing, nursing supervisor in duty, ER manager, physician, maintenance head, medical records manager, infectious control officer, and the meeting place will be taking place in the conference room of the administration block. The CCT, the decision is to call for a code green is made by the first CCT member contacted, gathering in the conference room of administration office and assume direct management for the hospital-wide response to the code green. Identifying specific responsibility for each member. All department head will report to this center. They will be advised of the type of the disaster, number of the victim, and the extent of the injury. This decision on the appropriate response from the hospital, allocate the staff and resources, and address such an issue as patient movement and scheduling. After consulting with the senior ER or his designee, declare the disaster is all clear. Here our command control system in drill. So the incident commander or the managing director, CEO, and the medical director check local authorities to verify the disaster and obtain additional information. Authorize announcement of code green, alert code green. Request assistance from the local police and the volunteer organization as deemed necessary. Notify medical record personnel as to when information can be released to the press. Public Relation Information Center. Provide authorities information about disaster to outside entity, including the press, will be obtained from the receptionist manager. General Information Center, designed to handle requests for information other than information about the disaster or victim, located in the administration offices in the ground floor. Man pool power, the pool of PSH personnel who do not have an assigned role in the code green. The pool is located in the outpatient waiting area on the ground floor. Assembly point for all PSH staff or volunteer to sign in and have a specific duty or response area assigned. Visitor Control Center, located in the atrium coffee shop on the ground floor. Families of the casualty will be instructed to wait there until they're notified of the patient condition. All clear code green, discontinue disaster plan. The announcement will only come from managing director or the CEO or a member of the CCT after confirming that the disaster has been resolved, averted, or controlled. Primary triage area, a system of sorting and prioritizing casualties before they are sent to relevant care areas located in an area outside the emergency room. Triaging team members will be responsible for conducting the primary triage. This will be composed of an ER physician and a senior ER registered nurse. Triaging tag. It's a color-coded identification tag applied to disaster casualties, giving instant triaging information and category of the victim. Here are the picture of our primary triaging area, just in front of the ER. And here our team in action. We'll talk about the triaging tag. Patients are tagged in primary triaging area before entering the ER and tagged according to their priority level. The tag should be applied to one of an uninjured limb. Preferred should be given to the following order: right arm, right ankle, left ankle. The tag should remain on the casualty until the external disaster situation is completed and all relevant documentation has been made in their medical record file or the patient is discharged. Here are the picture of the tags and how we apply the tag. And here our transfer in action. Now we'll talk about the zones. The zones are classification according to the casualties area, which are designed for secondary triage and treatment. Red zones from the resus through bid 6 through bed 6, immediate care patient whose condition is critical and who care cannot wait, care within 0 to 5 minutes. They are the first patient to receive care in the hospital. Then we have the yellow zone, which is an urgent care patient. Those conditions require care within 5 to 30 minutes. Then the green zone, which will be in the OBD clinic area, it's a delayed minor care walking wounded patient who can care be delayed. Then the black zone, finally, in the mortuary with the casualty who has been declared dead. Here our red zone and the ER. In our red zone, team assessment in action with taking some x-ray. Here our yellow zone also, and the yellow zone assessment going on. Still here, the green zone, the OBD. We'll talk about other personnel, the operator. He should obtain the following details if possible: name of the caller, phone number, natural of the incidents, place of the disaster. Inform or transfer the call to the ER physician on duty, informing the nursing supervisor also on duty. Head of ER or ER physician on duty. He informed the managing director of or first contact a CCT member. After approval, active code green through overhead bagging system. Initiate the emergency room disaster response as per the policy. Preferred primary triage area. Clear emergency department of all existing patients. Liaise with the medical director for deployment of doctors. Ensure that the command center team receives enough and continuous information about the status emergency department and the management of the patient arrive and admitted. Remain in the emergency department until the code is clear. Arrange large plastic bag and pre-marked brown envelope with label to be available in the ERs for patient valuables. The nursing supervisor duties to initiate call for the CCT member and also to liaise with the OR, MSP, and OBD, dialysis, and other units to find the availability of the bed and staff. Will act as an incident commander function until the managing director or his designee arrive. Will set up a command center in admin conference room. Also, she will allocate the staff member to initiate code green call out system and call department head or concerned staff according to the list. Allocate a staff member to manpower pool. Allocate a staff member to retrieve all crash card except in the ICU and OR and LND to ground floor OBD ophthalmology clinic because they are accessible to the ER. Allocate a staff member to retrieve all wheelchair, call doctors, call IT to provide additional telephone needed. The admission department also will initiate the call tree and supporting the registration of the patient at any point of entrance while in the disaster mood. Train staff for registration of unknown patient. Assign staff for registration in all zone, minimum of 2 in each department. All patients received in ER are registered as a disaster patient, tagged and given care consistent with other patients in the same category. This includes that patient comes from the disaster site and the patient who present on their own or by ambulance. The medical record officer will allocate each disaster casualty their own external disaster medical record and recording the following of the external disaster log sheet. Name, if known, age, sex, medical record number, zone, time in, time out, and transfer to unit or ward, or transfer outside the hospital and discharge. In case of death, will document the time of death, the name of the physician certifying the death, signature of the physician certifying death, name of the witness, signature of the witness, and victim that expire at the PSH are taken directly to the morgue. The outpatient manager will initiate also the call tree, suspend all normal OBD procedure, arrange for at least one consultant level physician from each specialty to be available from the ER, ENT, orthopedics, pediatric, surgery, dental, nephro, and gastroenterology, OB and gynae. Appoint staff for registering all green triaged patients arriving to the disaster from the disastering site. Manage all the green zone. The IT department also will facilitate the communication through internal telephone extension, mobile phone, public address system, allocate 6 phone lines and 2 operating systems during the disaster. Director of nursery. It's to proceed. Of course, she will proceed to the CCT room. Will do the incident. Will be the incident commander function until the managing director or his designee arrive. Inform nursing department manager and charge nurses. Assist nursing supervisor. Update current patient census in the hospital. Operating room manager and charge nurse shift in charge will initiate the call tree, cancel or hold or elective cases, prepare secondary surgery triage in the OR, outside the OR area, prepare OR to receive patient, ask for additional help if needed to carry out surgery and treatment OR or in the OR and recovery room, assign and direct scrub and circulating nurse, notify the red zone team and secondary surgical triage team when OR is available for more patients. Keep maximum list of supply on hand and be prepared to process additional sterile supply quickly. Notify anesthetists who will maintain adequate anesthesia drug supply. The ICU also will prepare to admit critically ill patient, suspend elective admission, evaluate the patient in the intensive care unit for possible discharge, use established discharge criteria as a guide, transfer patient out if indicated. The laboratory supervisor on duty will also initiate the call-out tree, automatically deliver O negative blood to the ER, liaise with the Salmania Medical Compound Blood Bank for emergency supply, respond to the request for laboratory supply, and provide phlebotomy service to the ER in red and yellow zone. The head of radiology department also and the radiology supervisor in duty will initiate the call-out tree, shift portable X-ray unit to the ER, shift ultrasound machine to the ER, assign radiologist in the ER. Pharmacy manager and shift in charge, provide manpower and pharmacy supply to the ER, OPD clinic, and other patient treatment area upon request. Visit ER and OPD on regular basis to collect stock sheets and replenish supply. The respiratory therapist also will obtain respirator and equipment as needed. General store, medical store, and the CSSD and the biochemical in charge will provide disaster supply from the medical store by runner without request from. Signature can be collected on delivery time. Support service manager. Initiate call out tree, establish a mechanism to transport patient PSH staff to the hospital. Ambulance driver should be available for the whole duration of code green. Additional driver for retrieval of blood from the blood bank and other services. Security also will be needed to provide control for all entrance in BSH and vehicle entrance and traffic control into around the ER and the outpatient. Maintenance manager will also initiate the call-out tree and identify key function and assign resources. Be prepared to set up extra beds. Dietitian will be prepared to serve nourishment to the ambulatory patient, inpatient, and personnel as needed area. Clear all a hallway from all trays and be responsible for setting up a basic menu to disaster situation and maintain adequate supply. The housekeeping also will provide additional housekeeping staff to all zone, will be sure that the all hallway or traffic area are clear of cleaning part and equipment. So what are backup and alternative sources of initial utilize of BSH? Hospital has the capacity to store water for 2 days, even if the supply from the electricity and water authority is interrupted. Hospital has an agreement with the contracting company to provide water and diesel in case of emergency. The backup generator and the UPS is provided as an energy sources of electrical power to all critical area. Operation theater, intensive care units, etc. The available oxygen cylinder has the capacity to meet the need for approximately 2 days. Whenever additional requirement for oxygen arise, the hospital has an agreement with a contracted company to supply more oxygen. For the nitrous oxide, 6 cylinders are already available for current use, and 2 standby cylinders are also available to use in the event of emergency. The hospital will provide for alternative communication method in the event of failure of communication, like walkie-talkie and mobile phones. So which alternative care site when the environmental cannot support adequate patient care? The CEO or his designee shall be responsible for inter-facility communication between the hospital and the designated alternative care site, and for retraining record of which patient were transferred to alternative care site. The patient care unit transferring the patient is responsible for obtaining copies of the patient medical record, gathering personal belongings, and ensuring that the patient medication are continued throughout the transfer. If any hospital equipment is transferred with the patient care unit is responsible for documenting and what equipment was transferred and what patient with the patient, so that the equipment will be retrieved during the recovery phase post-disaster. Facilities identify for such transfer. Of course, like hospital, we have 2 main big hospitals, Salmania Medical Compound, which is 5 kilometers away from BSH, and King Hamad Hospital, which is 4 kilometers away. Management of personnel conflict during disaster. In situation where staff personnel responsibility conflict with the hospital requirement for responding to the emergency, the following procedure will be followed. When travel to work safely is compromised due to external disaster situation, such as unrested hospital, management provides arranged transportation in coordination with the local police. If extended hours of work required, working hours shall be compensated as an overtime payment. Other provisions like daycare facility for caring for young children of staff shall be provided if required during extended hour of work. Staff with vulnerable conditions such as pregnancy are reassigned during disaster. Staff education and orientation. During new employee and refreshment orientation, the employee will be familiarized with the hospital and department's emergency preparedness disaster response program. In order to demonstrate competency, the employee will be tested. Ensure that the department staff are knowledgeable of the hospital and the department-specific plans that address problems that could interfere with the patient services or the risk of safety of the institution and the person who are in the institution. Ensure that the staff provide quality patient care service during a disaster situation. Ensure that the employee remain calm in the disaster services, and efficient utilization of supplies and equipment are necessary. We'll also have an annual evaluation of the disaster management plan, and will include a review of the scope according to the current GCI and NAHRA standard to evaluate the extent of which plans meets a credential standard and the current risk assessment of the hospital. A comparison of the expectation and the actual result of the plan will be evaluated to determine if the goals and the objective of the plan were met. The overall performance of the plan will be reviewed by evaluating the result of the performance improvement outcome. The overall effectiveness of the plan will be evaluated by determining the extent that expectations were met. The performance and the effectiveness of the disaster managing plan shall be reviewed by the facility management and the safety committee. Annual mock drill are conducted to make sure that all staff are well prepared in case of emergency. Finally, the summary. of the code green. So the external disaster are a situation outside the hospital, receiving call from MOH by operator, transferred to the ER physician on duty, and he will inform the CEO or his designee after approval, announcing over the head bagging system, attention, code green, 3 times in English and Arabic. Call out 3 should be activated by every department. Preparedness and locations, triaging area outside the ER, like a parking area of the ambulance, the red zone ER from resus bed 1 to 6, and the yellow zone from bed 7 to 14. Green zone will be in outpatient department in the ground floor, and the black zone in the mortuary. Command control center will be in the conference room. There will be also a manpower pool in the OBD area. Patient victim attendance relative at atrium ground floor, guided by the main receptionist. Breath at staff cafeteria, basement, and any information shall be released after approval of the CEO by public relations. Terminated code green, all patients are treated or shifted from all zone, announced as all clear, code green. That's it. Thank you so much. Here is some picture of our old gel.
Thank you very much.